My Health, My Knowledge, My Way. Introducing Leanne,
Rebecca,
Louise, and Moya.
Welcome to our podcast from the Doncaster Learning Disability Health Team for those living in and around the Doncaster area. As we know, people who have a learning disability have poorer health than the general public, and there is also a poor uptake for people who have a learning disability to attend cancer screening appointments. Today, we are going to talk about annual health checks. So, who can have an annual health check?
Anybody with a learning disability from age of 14.
Fantastic. So we know that anybody over the age of 14 with a learning disability is entitled to a free health check if they're on the doctor's learning disability register. You can check this with your doctor, or you can check that with your learning disability nurse if you have one. This is something that you'll be invited to once a year. Annual health checks are important to help you spot any problems sooner and that treatment can be started to help you stay well. It also gives you a chance to talk to the GP if you've got any worries about anything. Louise, do you have to be poorly or feel ill to have a health check?
No.
No, you're right. It's something that's offered free, and it just helps us to monitor people's health, particularly if you've got any health conditions such as diabetes, asthma, epilepsy, and any other health need. These can be looked at, and any changes to medication can be discussed. So, Moya, what happens during the annual health check?
You might need to see several professions, such as a nurse, healthcare worker, doctor, who will check your weight, heart rate, and blood pressure. Your vaccinations will be looked at to make sure these are up to date. You will have a medication review to check to see if the medications that you require need to be increased or stay the same. They may ask for a sample of blood or urine. They may require you to go for further tests if they have any concerns, or this is okay, as it means you will catch any health issues early on.
Making reasonable adjustments during your health check. So when booking your appointment, you can ask for a longer appointment time, and the GPs have to make reasonable adjustments. But what does this mean?
So, Leanne, it means that doctors can use pictures or large print or use simpler words to explain what's happening, give you lots of reassurance and help you to understand and to be able to agree to have it done. We can look at times of day. Some people prefer a morning appointment, some prefer it later on in the day, depending on what your lifestyle is and how busy you are. And double appointments just means that you've got a longer time to talk to the doctor about any worries that you might have, or for you to ask more questions to help you to understand.
Any reasonable adjustments need to be put into your health passport or health action plan that you take with you to the doctors. If you haven't had an annual health check, contact your GP to ask if you are on the Learning Disability Register, as you might be eligible to have one.
So, Louise, why is it really important that we go for that annual health check?
Because they might pick up something that you don't know you got, like high blood pressure.
Yeah, and that's nothing to worry about, is it? Because doctors can help us find a way to look after ourselves better. So, we'll remind you all to make sure that you have your annual health check, and if you haven't had it, ask your doctor about it. So, thanks for listening to My Health, My Knowledge, My Way, and next time we're going to be talking about the menopause or the change. Thanks a lot.
Bye.